One of the projects you're known for is working to move underserved patients out of the emergency room and into the doctor's office instead. Over 5 years, you managed to save 42% of costs for the patients you worked with. How'd you do that, and what were some of the hurdles you faced?
So the simple project we did is we put outreach workers and patient navigators and community outreach workers in every emergency room within our county. And when a person showed up who was uninsured, we would ask them would they be willing to enroll in a program, which was the Voices of Detroit program. And what we would say to them is we would give you access to a primary care physician at significantly reduced costs, and maybe based on a sliding scale, no cost. And if they allow us to track their care across our systems. We actually ended up with 33,000 people in the program. We were able to transition 55% of them out of the emergency room. When you get people out of a high cost setting at an average of $1,000 per visit into a practice that is a primary care visit at $30 a visit, you transition a significant part of that population into primary care settings.
What's it like in a clinic like the Health Centers Detroit Foundation where you work? Can you describe the type of patients you see, what kind of services you provide, and maybe some of the problems that you see?
We, the patients we serve an underserved population, so about 75% of our patients are either have Medicaid or are uninsured. We know by our study and tracking and our surveys of that population, the average family income is about $10,851 a year. So it is a very difficult population because oftentimes when we want to adjust things, I want to prescribe a medication, you're uninsured, we're trying to figure out how you're going to get that medication. People are literally having strokes and heart attacks because they can't get access to a very simple medication. I had a woman who was uninsured who showed up and came to me, was admitted 5 days for pneumonia. We cared for her. We cured her pneumonia, which is the 6th leading cause of death in the United States. Treated it perfectly fine. She did well, came out with a $28,000 bill. She had no health insurance. $28,000 is bankrupting her. And this is what people are coming out of hospitals with.
How will the healthcare overhaul affect the access this population you're describing has to healthcare, in particular specialists, primary care, and of course hospital care?
The healthcare reform will be huge. It is a massive needle mover. We're talking about 33 million people who are going to be brought into the fold of coverage. I don't believe in a country such as ours, that's the way to go. Health disparities increases cost of care. If you having people who are uninsured increases the cost of care, because it's not that people aren't getting care. They are getting care. They're just getting care in the most expensive arena, and that's hospitals and emergency rooms at 10 to 20 times the cost. And people always say, well, is that my problem? I always tell people in the audience, all those who are insured, raise your hand. When they raise their hand, I say, all those who just raised their hand, your current premiums, you are paying $1,200 to $2,000 currently in your premiums to cover the uninsured. We're already paying for the uninsured. We're just paying at tremendously high costs as opposed to we would pay if we were to get them into the fold and stop marginalizing that population.
What about access?
Yeah.
What are some of the hurdles to get providers to accept Medicaid and hospitals to really treat those people that may or may not be helped by the overhaul? And how do you get providers in your community to accept Medicaid?
It's a struggle because Medicaid is going to pay 30 cents on the dollar. So it is a struggle for people who are on that and have that particular insurance to have providers accept it. We live in an urban community. I'm with an academic health system and with a federally qualified health center. And so it is part of our mission to care for this population. But you're right. Half of the healthcare reform is the expansion of Medicaid up to 133% of poverty. Okay, well, it's still Medicaid, and it's still going to be a challenge having providers see that population.
Dr. Smitherman, thanks so much for joining us.